abutments and the flap from getting acrylic down there and creating a problem that we have to clean out, or acrylic that might stay in there that you don't see. And really important step is to place these tall healing abutments while the surgeon is suturing it together, because we don't want that tissue to collapse around the abutments, because once the prosthesis is all finished and polished, that might be 20 minutes to a half hour later. If that tissue's collapsed, we're going to have a really difficult time seating it. So you want to keep those in there right until before you're going to seat the conversion prosthesis. So here's the finished prosthesis. All the little air bubbles are cleaned up. Where there's voids, material is added, and it's very highly polished with burrs and pumice and rubber wheels, so that we have a nice smooth surface that doesn't pick up plaque. Those back teeth have been removed, as you can see, because we don't need them anymore, and the prosthesis is seated, and the occlusal screws are torqued to 15 Newton centimeters. What we do is we torque those screws, and we walk away for about 10 minutes and come back and torque them again, because a lot of times the tissues will hold up the prosthesis, and when you go back the second time, you'll see that those screws tighten down a little bit further. Very important to adjust the occlusion at that surgical appointment. We don't want any one interference hitting on one of the implants and causing trauma to that implant, or you're going to end up having a failing implant. So we get the prosthesis very nicely balanced. We adjust it. We use our articulating paper, and we want to get equal contacts across the whole appliance and no contacts on if there's any area that is cantilevered off the back. So this is our patient 5 days later. You can see that, and we see this typically after these surgeries, kind of disrupts the muscles and the nerves of the upper lip, and the patients don't seem to have that hypermobile lip. She understood ahead of time that could return, and if it was ever a problem, then she would have to consider using some Botox to keep that lip from going up so high. So there's a before and after, a very successful result. We are now in the process of finishing her case. She's in her PMMA prototype, and her next step is going to be to create her final prosthesis. This is the post-op radiograph. See, those implants are very nicely placed. Those cylinders are all very parallel to each other, and the bone reduction is flat across, just like we like it. So for this case, we reviewed how we work up a case. We demonstrated the benefits of a guided surgery using Straumann's Smile in a Box. We presented the step-by-step protocol for maxillary pro-arch conversion surgery.